As a society, we're fortunate to offer a number of awards and fellowships throughout the year. You can see all of these awards and list of awardees in the program, meeting, and the meeting app. Thanks to all our committee members and chairs who've worked to select these awards. We have the bulleted list of them up on the screens there. So congratulations to all who received these awards. The Society now wants to acknowledge the 2019 Fellows of ASTMH. We recognize these members for their sustained professional accomplishments in tropical medicine and related fields, and Fellow of ASTMH designation is available only to members of the Society. Will each Fellow please stand as I read your name? I ask the audience hold its applause until the end. And the Fellows of ASTMH are Carter Diggs, Albert Igsang Ko, Amy Klyon, Daniel Leung, Siddhartha Mahanti, Julie Pavlin, Anne Ramoyne, and Mary Wilson. Congratulations to all of you. Every year we also recognize international leaders in tropical medicine through a special recognition called the Honorary International Fellows of ASTMH. These honorees are recognized for their eminent contributions to a particular aspect of tropical medicine and/or global health. Because of time constraints, I'll give only brief highlights of all the accomplished scientific achievements of the individuals we're about to honor. But please, as you see them stand, please introduce yourself and talk to them because they've done amazing work in the field and are extraordinarily inspiring people. Going in alphabetical order, our first Honorary International Fellow is Tamid Ahmed. Dr. Ahmed is internationally recognized for his research and expertise in child malnutrition. He was a member of the writing group for the pivotal Lancet series on maternal and child undernutrition in 2008 and 2012, and he has made fundamental contributions on the role of the microbiome in malnutrition. His work on how diarrheal disease disturbs the gut microbiome opens a possibility of prevention of GI infections through reconstitution of a mature microbiome. Dr. Ahmed, could you please stand? Congratulations. Congratulations. Our next honoree is Dr. Martin Grobusch. Professor Grobusch has worked in multiple low and middle income countries as an educator, clinician, and investigator in tropical medicine and global health. He's published more than 425 peer-reviewed papers, and collectively his work has had a major influence in the care and management of multiple important life-threatening infections, including Ebola, TB, HIV, and malaria. And he's pushed these advances all the way towards improved health outcomes, especially in LMICs. Professor Grobusch, if you could stand, and congratulations. Thank you. Our next honoree is Dr. Clara Menendez. Professor Menendez is one of the founders of the Manisa Health Research Center, which has become a leading research and training facility in Mozambique and all of Africa. A major area of her focus has been description of the causes of maternal and child deaths based on minimally invasive autopsies. This important approach, which Professor Menendez has led from the inception, may help better describe the cause of death in areas of high mortality and poor access to patient care. Professor Menendez, if you could stand, and congratulations. Our next honoree is Dr. Pascal Ringwald. Dr. Ringwald is a leader in defining, monitoring, and containing anti-malarial drug resistance globally. He set up the WHO Global Database on anti-malarial drug resistance and helped to standardize the methodology of monitoring anti-malarial drug efficacy. His work on artemisinin and resistance in Southeast Asia and the conceptual drive to eliminate malaria from the greater Mekong sub-region are major international contributions. Dr. Ringwald, if you could please stand, and congratulations. Our fifth and final honoree is Dr. Alan Saul. Dr. Saul has made notable contributions to the development and testing of vaccines against malaria and other tropical infectious diseases. His malaria vaccine trials in Australia included pioneering work in developing a blood stage challenge system, and his work as co-director of the NIH Malaria Vaccine Development Branch with vaccine trials in the US and Mali played a major part in the advantage of malaria mosquito stage antigen vaccines. He also established and later directed the Novartis Vaccine Institute of Global Health in Siena, Italy, which is now the GSK Vaccine Institute for Global Health. Dr. Saul, if you could stand, and congratulations. What I gave you is just a hint of what these giants in the field has accomplished. It's an honor to thank them, and as I said, please introduce yourself to them. ASTMH prides itself as a place where people at all levels can talk to each other and learn from each other, so thanks again. I'm moving on to the next award, which is the Alan Magill Fellowship. The fellowship was created in 2016 by the Society's board in partnership with the Bill and Melinda Gates Foundation to honor the life, example, and legacy of Alan Magill, a deeply respected leader in the global tropical medicine community who passed away suddenly in 2015, just a year after serving as president of ASTMH. The Magill Fellowship provides $50,000 in funding for up to 2 years for one recipient from a low and middle income country. These funds support mentorship and career and leadership development projects in tropical medicine for the fellows who are in their early to mid-career. The career broadening experiences supported by this fellowship provide learning and leadership opportunities well beyond those typically available in the applicant's home organization, and in doing so, they make the awardees ready to assume future leadership and mentorship roles in tropical medicine. Our 2019 Magill Fellow is Deusdedith Ishengoma, a member from Tanzania. Dr. Ishengoma, would you join me on the stage? Dr. Ishengoma is currently completing training at CDC to establish next-generation sequencing methods for surveillance of molecular markers of anti-malarial resistance in his lab in Tanzania. He'll use the Magill Fellowship to develop skills to translate and integrate scientific evidence into policy for malaria elimination in Africa. His policy training will include coursework at the Harvard T.H. Chan School of Public Health and an internship at the WHO's Global Malaria Program, and both of these activities will be under the mentorship of Dr. Diane Worth. On behalf of the Society and all of us who continue to be inspired by Alan Magill, we're pleased to recognize you as a 2019 Magill Fellow, the third in a cohort of 20 over the next 2 decades.
Thank you so much to ASTMH for giving me this award. I strongly believe that we will eliminate and eradicate infectious diseases, but with the focus to people who actually suffered and lived the disaster of infectious diseases, will attain this goal. Thank you so much, and this is actually the first step, the great step towards working with the people. Thank you.